Hey everybody, it is day 3 of National Sleep Week. We are so excited that you're back joining us today for another Facebook Live video. We are joined today by my dear friend and psychiatrist, Dr. Elizabeth Nicholson.
Hi guys.
Yeah, we are so excited to talk to you today about mental health and sleep. Obviously it's sleep week, so we've been trying to give you guys sleep tips all week long about ways to increase the duration of your sleep, get your children to sleep better. We've been talking about different tips in your sleep environment, like decreasing your thermostat, things like that. But today we're getting to something that's near and dear to my heart because I was a child psychologist before I started Wicked Sheets, but I really like to talk about the importance of sleep and mental health. And so before we jump into that, why don't I let Elizabeth tell us a little bit about her background and how you got interested in becoming a psychiatrist.
Okay. All right. Thanks so much for having me today. So I went to University of Louisville for medical school. I'm born and raised Louisvillian. I did my residency training at the University of North Carolina at Chapel Hill. I am currently completing a fellowship in integrative medicine through the University of Arizona in Tucson.
Oh, I didn't know that.
Yeah, which is I think even better for what we're discussing today because it really looks at lifestyle, and sleep is a huge thing we talk about with our patients, just about general wellness and feeling good. So
awesome. That's fantastic. Yep. See guys, I didn't even know that was going to happen today, so even more exciting.
Yeah, so how I got into psychiatry, well, I always wanted to help people. I always knew from a young age I wanted to be a doctor, and so kind of those things bled together into me really liking mental health, and it seems to be still well suited for me.
That's great. And right now, I do want you to share a little bit about your current job, what you're doing, because it's all the rage right now, right? Telemedicine is the rage in terms of treatment and being able to be a doctor on the spot when people need it. So do you want to share a little bit about telemedicine and how it works?
Yeah. So I practice telepsychiatry, so I see patients virtually. Currently I'm seeing both adults and children that are having some sort of mental health crises that present to an emergency room, typically a medical emergency room, and they consult our service, and then they get that specialized evaluation and care from myself or one of my colleagues.
Okay, that's awesome. I remember I hear a lot of business pitches from time to time, and a few years ago there was a company that came in and they were talking about telemedicine as a treatment for substance abuse. So folks that were recovering alcoholics, and obviously when you go to an AA meeting you have a sponsor, things like that, but this was folks that were suffering on the spot, feeling tempted that they were gonna be able to call this particular company and have a resource and someone to have a shoulder to cry on if they needed to, or just some support. And people in the audience were fully supportive of it because they just thought, what a novel idea, and how beneficial could it be to people on the spot who are really in need of help.
Yep, I think mental health issues are quite common, and so we need all the help we can in getting these folks the care that they need. So.
I love that. That's great. So talk to me a little bit about the people that you treat. What are the most common disorders, mental health issues? I mean, obviously I know anxiety and depression, but
yeah, so anxiety and depression are by far the most common issues that I would treat. Certainly in the emergency room setting we see some more acutely ill, which I don't think is what we're here to discuss today, but certainly I think anxiety and depression are the more common issues that we see.
Okay.
Yeah.
And as it relates to Wicked Sheets, a lot of our customers come to us who are experiencing night sweats as a result of anxiety or depression, and something I know we're going to jump into in a second here is it's not only just a symptom of anxiety and depression.
Right.
A lot of people don't realize they have anxiety until they wake up in a panic and they're in a full-blown night sweat.
Right.
But also, oftentimes, some of the medications that they're on create night sweats as a side effect. So I think it's really important that folks that are on medicine, knowing that there are side effects to these certain medications, the medicine is still working, but there might just be some side effects that might not be wanted or desirable, but it's also a sign that the medicine is working.
That's true. I mean, yes, there's many medications, not just related to mental health, that can have sweating as a potential side effect. So I think being educated and knowing what you're taking and the potential side effects, and working with your doctor, your provider about side effects, and making sure you're getting the treatment that you need to treat the symptoms you're experiencing is really important.
Right. I love that. So why don't we just jump right into sleep and mental health? Okay. And I know with this integrative medicine that you're studying right now, and kind of what's the name of the approach? It's like the biopsychosocial approach, but really
it's like looking at the mind-body connection. So really thinking that everything is interconnected, and really lifestyle plays a huge role into that. And so we think about sleep, diet, exercise, community, social interactions. All these things are really important when we think about our overall wellness and health goals.
Okay.
Sleep is a huge, huge thing, and a topic I really like discussing because it's somewhere where we actually have some control a lot of the times. Now with anxiety and depression, for example, insomnia, so problems falling asleep or staying asleep, are very, very common as a symptom of both anxiety and depression. So you want to be sure to raise that in your meeting with your provider if that is a symptom you're experiencing, and it's also something you can track with your doctor as looking in terms of your depression or anxiety improving. We want to see that your symptoms are improving, and that's a good one to follow, is that your sleep is also starting to get better with time.
Okay.
But one of the things I do, think about the whole sleep topic is that most of us have some control in looking at our sleep habits and our lifestyle and helping kind of ourselves get better rest at night. So I'm happy to share some of those things with you if you'd like.
I would love that. The beginning of the week we met with another fellow entrepreneur. Her name's Donna Durham, and she started a weighted blanket company.
Okay.
And she's a marriage and family therapist, and a lot of the folks that she was seeing were experiencing anxiety, depression, and they were having trouble falling asleep and staying asleep. And so she did all this research and found that weighted blankets were actually something that were helping her patients stay asleep. But she also talked about the importance of sleep schedules for adults and things like that.
Yep.
Which was so funny because then we had a pediatric sleep specialist on yesterday, and she was like, it's all about the sleep schedule.
Yeah. So I'll try not to be redundant, but I guess what that highlights is it's just really important, as sleep hygiene is what we kind of refer to it as, is very, very important in overall quality.
Yeah, sleep hygiene is another great term that has really come to the surface as we talk about the sleep revolution over the last couple of years. And I love it because it's really taking care of your body. And Allie, who has OCD, right, is hygiene means cleanliness to me. So I really love talking about that. So for the layperson, sleep hygiene just means?
I guess it would just be like you think about taking care of yourself during the day, brushing your teeth, washing your face, getting fed for, in the morning, making sure you're doing all those things, getting out the door to work. It's kind of looking at the steps that you take to ensure good rest is kind of how I would look at it.
I love it. Perfect.
Okay.
See, she said it way better than I did.
I don't know that that's a good explanation, but okay.
It's great.
Yeah. So one of the biggest things I think about, and you kind of touched on this, is the schedule. A schedule is super important for children and adults. We want to try to mimic and stay in line with what a natural day looks like, right? So we want to get natural sunlight every day in the morning hours if we can. We say at least 20 minutes. That's going to help our overall mood, and it's going to help us sleep at night, believe it or not. Same thing goes for evening hours. You want to kind of mimic the dimness that happens in the evening as it turns to dusk. So you want to, is that right? Is it dusk?
Yeah, dusk. It turns to dusk.
So, you want to dim your lights if you can. You want to avoid bright lights, and you want to just start thinking about kind of getting into a relaxed mode, which we can talk about some specific things with that. And so going to sleep at the same time within about a 30-minute window, and waking up at the same time within a 30-minute window. A lot of people think that's counterintuitive or doesn't seem to make sense, but really that's super, super important, even on the weekends if you can do it.
Yes.
So maintaining a consistent schedule in that way. And then another thing we want to think about is kind of the noise, the body noise. So when I say that, I'm thinking of things that we contribute, that we're putting in our bodies, or things that we're doing that might not lead to a restful night of sleep. So the common offenders, and people probably have heard these before: caffeine, alcohol, nicotine, certain medications. So just to touch on a few of those things, we want to try to avoid alcohol close to bedtime. If you really must have a drink, you want to have a drink with food. Caffeine, some people are super, super sensitive and don't realize it. So even 1 cup of coffee in the morning can keep you up at night if you are one of those people that's super sensitive. The best
Can't
way.
have it after 2.
Yeah.
Literally, I can't have it after 2.
Yeah, I can after 3, but you don't want to know how much I consume in the morning. But for some people, really just a small amount will really push them over the edge. And because caffeine has a pretty long half-life. And so some people don't metabolize it as quickly. So those are some of the bigger things. You know, you want to look at your teas. A lot of times they have caffeine, and people don't recognize that. And then the bigger offenders, coffee and soda, nicotine products. So think about those things.
I'd always heard spicy food as well.
So that's another thing I was going to say. You want to avoid heavy meals closer to bedtime. And my guess with the spicy foods has something more to do with like the reflux, because a lot of people don't sleep well at night that have reflux, right? Because your body is trying to digest the food that you put in. So you really want to say 2 to 3 hours before bedtime, avoid any large meals and spicy foods if they're aggravating to you. If you knew, say you had reflux and that was a food group type thing that bothers you. Some people do well with small snacks at bedtime. You want to look at something that has more of like a complex carb makeup. If you don't understand that, that's kind of a Googleable term that you could.
You can get on Google.
Yeah.
On the Google.
Yeah, you can look it up on Google, but you want to avoid, really sugary stuff as well.
I always heard actually that like a graham cracker with a smear of peanut butter or
something like that, would be more suitable.
If you have that, a complex carb, then putting a little bit of protein on there, just a little bit, especially if you're someone that's trying to lose weight or is very carb sensitive. I used to be a personal trainer too. I used to try and help people when they would get really hunger cravings before bedtime. I was like, listen, I know you're probably craving carbs, but if you can, always put a protein on it, because then your digestion is affected, and right before you go to bed, then your metabolism can speed up a little bit.
Right, yeah, so I think that's a great tip. And onto you said the personal training. Exercise is another thing to think about when we think about body noise. Exercise is great, right? We want to promote exercise pretty much for most people. However, you need to be careful about what kind of exercise you're choosing to do in the evening. We want to try to avoid cardio because it can increase your body temperature.
Okay.
So,
yeah,
so within, again, the 2 to 3 hours, we want to try to avoid really intensive cardio. If you can try to do it in the morning, that's best. Something like a yoga practice, or that's not as intensive, that would be better for the evening hours.
Perfect. That's a great time for me to plug that tomorrow, actually, on our Facebook Live video, we are doing yoga and 5 Tibetan monk practices that help calm the body before bedtime.
I love that. I'm a big proponent of mind body stuff, so that is totally in line with those ideas. That's great. I'll be sure to check that out. That's great.
Happy.
That's great. So a couple more things on the noise kind of contribution. This is a common one, and people don't like to probably hear it. We are a society that is driven by social media right now and screens. They are not good for us when we're trying to get rest, right? So really want to be mindful and thoughtful of those things, and try to limit TV watching. I always tell my parents of teens, do not let them sleep with their phones in bed. It's just very distracting, and it really messes with our natural rhythm of sleep.
Sure.
Yeah.
Well, I know some of the things that they're reading, it can be content related, but also the lighting on the screens.
Yes.
I mean, that's just a shot of light to your brain going, okay, you need to wake up.
Right.
And
exactly.
Signals your body to really go into a state of wakefulness.
That's right. That's absolutely right. So we want to try to limit those things. It can be replaced with, we want to think about, again, the ritual or things that can help us get in a more relaxed state. So reading a book would be a good idea. Some people,
what are those?
I know. Some people find taking, a warm bath. You can use essential oils like lavender. Lavender is very soothing, and it can help folks that are anxious and just kind of get into that stage where you're more ready to go to bed.
I love that.
Yeah.
So great.
Yeah.
I think you did hit on a bunch of stuff that we did not get to include this week. So there was no redundancy there.
Okay.
We are forever grateful for those tips.
Wonderful. Yeah. The last thing I'll say, my last plug about healthy sleep habits is, if a lot of people, feel we have a big meeting, we have a big day the next day, and so you're feeling anxious as you go to bed, and you get this idea, I have to go to sleep, I have to go to sleep. One of my professors started talking about it, to let go of being awake, and so just kind of changing the way we think about it. Okay. I thought that was helpful. But if you're having a difficulty sleeping, we generally recommend getting out of bed.
Really?
Yeah, after about 20 minutes or so. And we don't want to be checking alarm clocks, so it's kind of a tricky thing. But the light on it can mess with your natural sleep cycle. But getting out of bed, leaving the bedroom, you only want to be using the bedroom for
sleep and sex.
Yeah, you said it.
I'll say
I didn't know if I could say it or not.
With
but
a name like Wicked Sheets,
I
talk about sex all the time.
That's right. She's right. So that's the only reason why we want to be using our bed. So get out of bed, go do something that, people think, oh gosh, I can't sleep. I might as well do something productive. That's not really what we want you to do. We want you to do something that's also just relaxing. So whether it's reading a book or something of that nature, when you start feeling sleepy again, head back to bed, repeat until you fall asleep. Yeah.
I actually never knew that you should get out of bed.
Yeah.
I just figured, okay, you stay in here, you're basically just going to go through the process and kind of will yourself to sleep, but clearly that's not the case.
Right, yeah. Try, and these things take practice. So I would say to my patients or family, whoever I'm trying to help, don't get discouraged if you try one or two of these tips and they don't seem to work for you. I think repetition and practice is really where it's at. And we do have a lot of control over some of these things.
Yes.
Yeah.
Oh, I love that. Now, so let's say we are in bed, and I know your specialty, anxiety, right? Let's say you are having some sort of anxious moment in bed. I've heard a lot about four-square breathing.
So four-square breathing is not something that I don't know that specific technique, but I know 4-7-8 breathing. I'm a big proponent of breathing exercises.
Okay.
And what it does is, so it helps tone down kind of that hyper-aroused response that our body creates. When we have an anxious thought, our heart rate might go up, we might start feeling sweaty, all these things that then can contribute to our anxiety. But when we do breathing exercises, it helps reset that. So whether it's the 4-square breathing, 4-7-8 breathing is another wonderful technique. Those can be really effective.
Oh yeah. And I'm sure if you want to do step-by-step instructions on them, you can also find those resources online, YouTube videos. I know when I first started learning about mindfulness and meditation, I watched YouTube videos out the wazoo on just how it's done, and it actually walks you through and does countdowns on the screen. And there actually are, I know we're not doing technology in the bedroom, but if you are feeling anxiety throughout the day, I know the new apps on the iPhone like Calm and... Yes,
there's several. Oh gosh, I didn't...
I know, I didn't ask you to prepare for this, sorry.
No, it's okay. Insight Timer is one.
That's right.
There's another really good one.
I think like Here and Now, or... There's another one.
There's
you can find them
Insight Timer, and I'll have to think on the other one. I'll let you all know if I think of it. There's an app. I have not personally tried it, so I can't vet it, but CBTI. So cognitive behavioral therapy. I think you're having a psychologist later this week, and so hopefully they'll touch on it. But it's a wonderful type of therapy. And, we use medications a lot for insomnia, to treat insomnia. Or if it's insomnia caused from anxiety and depression, we want to get to the root of the anxiety and depression, and maybe using a medicine to help with the insomnia. Really, these medicines are meant for short term. Something like cognitive behavioral therapy for insomnia is where the money's at. That's where you're really going to learn things that you can do to help, because what happens is we start to get these beliefs in our mind that we can't sleep, we can't, and so we can revisit those with a professional and learn to kind of challenge those thoughts and reshape the way we think about sleep and falling asleep. So there are some apps that you can look into, but again, CBTI is one that I've heard of, but I haven't personally looked at.
Okay. Yeah. I'll look some up. We'll put them, we always do blogs, and actually a lot of times we do blogs like night sweats and anxiety or depression or post-traumatic stress disorder. So I'll make sure that when we do our blog, actually I'm going to put one up later this afternoon after our discussion with Dr. Nicholson about different resources you can find. So I'll make sure I put a list of those on our own blog site.
Great. Wonderful.
So I got to ask the question, what do you think about sleep environment?
Yes, okay. Gosh, I'm so glad you brought that up. That was another, yes. So super, super important. When we are thinking about, again, just this general concept of lifestyle and what we can do, the sleep environment is so important. So we want to generally think about an area that is cool, right? We generally say keep your thermostat around 68 degrees. Don't let those other people that may be in your house adjusting it, because that certainly can
sweats and socks to bed.
Right, and Allie can tell you the clothing we want you to wear to promote a cool environment for your body. But we want to think about comfortable sheets and bedding and all those things, and a psychologically safe space as well. That's really important. Probably a broader topic than we have time for today. Right. But when we think about a sleep environment, we want it to be cool, dry, you want to feel safe. And if you are having problems with insomnia or nighttime sweating, your product is a great one to consider in terms of making those adjustment things that we can do to help control the issues that we're having. So.
Oh, thank you.
Yeah.
I appreciate hearing
No, but
that.
it's true. I mean, that's what we, want to think about, things that we can modify or adjust that are going to help us have a better night rest.
Right. I stated it yesterday in our interview with our pediatric sleep consultant, because we were talking about the crib sheet and how beneficial it was to help keep babies sleeping. So they're dry after they're drooling, or they have leakage or things like that. But that we really want to be a medical lifestyle product. We want to understand night sweats or overheating in the bed and address it in a lifestyle way. So understanding mental health issues that might contribute to night sweats or overheating has been at the core of our business the whole time. And sometimes people ask me, like, why do you interview doctors all the time? And I'm like, because we are humans and we suffer from certain things.
Yeah.
And I just, like you, I always wanted to help people growing up. I started out wanting to help kids, and then I got into sweating, and I was like, well, let's help menopausal women too.
Yeah, I mean, it really hits a large percentage of our population if you think about it. So you're helping a lot of people. Yeah.
Yeah, I actually found a great statistic. It was between 50 and 70% of people with sleep disorders or chronic sleep issues have mental health issues as well.
Yeah, there seems to be a bi-directional relationship for many psychiatric illnesses and sleep. So meaning that if you're depressed, you're very likely to have sleep issues, and as those improve, one or the other will improve.
Right,
So.
right. Oh, it's great.
Yeah.
Well, is there anything else you'd like to add in terms of the sleep hygiene, or touching on, I think we hit them all.
I think
really.
we hit it all, and I think, the emphasis is that we spend a third of our life sleeping or in bed. So this stuff is actually very important.
Absolutely.
Don't blow it off. Think about some of it. Yeah.
And be intentional with your sleep. Don't just abuse it on the weekends when you're staying in bed. Actually, that's another blog I'm getting ready to do. People are like, oh, well, I slept until noon on Sunday. And just like you had mentioned, waking up at the same time every day is actually better for your circadian rhythm and your sleep cycle.
It is, yeah.
And everyone's like, oh no, I treated myself. I'm like, oh, but actually it's not.
Yeah.
That's like you eating the ice cream sundae with hot fudge, and you're like, I treated myself. And you're like, well, really, your belly does not thank you.
But it does sound good. Right?
I know.
It's tempting, right?
Okay, every once in a while. I'm not gonna lie, I had one last night. Okay, so if you don't mind touching a little bit, I know as a psychiatrist, part of your job is dealing in medicine.
That's right.
So if you wouldn't mind sharing just a little bit about common medications that people are on, and maybe the difference between SSRIs and benzodiazepines.
Sure.
And kind of like what they're used for.
Sure. So when we, going back to the sleep habits things, and we were talking about body noise, and we want to think about medications. And in this case, we are going to talk specifically more about, I think, the sweating. But SSRIs are called selective serotonin reuptake inhibitors. Okay, they are generally the first line group of medicines generally that we think about for common depression and anxiety symptoms. Okay. They tend to be well tolerated by most groups of people. So what they do, I don't know if you want to hear the biochemical, but basically...
Oh, I would love to.
Okay.
I love that.
All right. So they work at the receptor level of the serotonin where they block the reuptake of it. So by doing that, it increases the amount of serotonin available.
Okay.
Which is generally what we think about. It's a very complex system, but to put it more in basic terms, we think about serotonin as one of the neurotransmitters that is primarily responsible or involved in both depressive and anxiety disorders.
Okay.
Okay. Benzodiazepines, that's a different class of medications. They work on a different group of receptors, and they tend to be prescribed for things like panic disorder, other anxiety issues, sometimes insomnia, and some other disorders as well. So they're good for the short term. They can be very effective for the short term treatment of those things. My personal preference is to try to work with patients to find other solutions over time that will help treat those symptoms. Just because their side effect profile over time can be one such that you can develop what's called tolerance, where you need a higher dose to get the same effect. And some people actually can develop addiction to these medications, which isn't a fault of theirs. It's just the way these medications work. So, and they can cause things like confusion and falls, so we need to be careful in certain populations of patients. But so, again, going back to the SSRIs, thinking about treatment of depression or anxiety, they generally are very well tolerated, but there are, as any medication, there's potential for side effects.
Sure.
And sweating can be one of them.
Right.
Okay, for SSRIs and lots of other groups of medications. Okay, so what you want to do, if that's happening to you, I have to give the plug, the disclaimer, you need to talk to your doctor.
Right.
You need to rule out something more serious, that nothing more serious is going on, because night sweats could be a symptom of something else that really needs to be identified and treated by your doctor. Okay?
Absolutely.
So you want to make sure you go to your doctor. They're taking a very good history. By that, I'm talking about how long have these symptoms been going on? Have you been around sick contacts? What medications are you taking? When we think about medications and sweating, it's a diagnosis of exclusion, meaning that you've ruled out other causes. Okay. So if this has led you down the path with your doctor where you're looking at your medications, we look at what's called a temporal relationship, looking at the time the medication was added and the timeline of your symptoms. So if there's an association in this, example, an SSRI. So common SSRIs are like Prozac, Celexa, Zoloft, Paxil, Lexapro. Those are all in that same family of medications. So if one was identified kind of based on the timing of symptoms as possibly causative of your night sweats, there are a few things you can do with your doctor to try to minimize that. Okay. So some things you might consider are reducing your dose. Again, you have to do this with a healthcare professional, because if you're on a medication for depression, you don't want to have your depressive symptoms necessarily worsen. So this is a careful conversation you have to have with your professional. But considering reducing the dose, considering going to a longer acting formulation of the medication sometimes can help. Sometimes switching medications can help. Sometimes we add another medication to treat the symptoms of sweating. And sometimes, the patient and the doctor, you'll decide together that, I really like this medicine. It seems to be helping me with whatever I was started on it for. And I don't want to add another medication, or I don't need to reduce the dose because this is the dose that's been helping me the most. And that's where something like your product comes back into consideration, right? Because looking on how to manage those symptoms.
I love that.
Yeah.
But I think, again, I'm going to reiterate, talking to your doctor and not being someone that diagnoses themselves with issues.
Please don't do that.
Please do not do that. Don't reduce your medications. And I'm so glad that you mentioned that, because a lot of people, and I have really good friends that have been through treatment for depression, and they say, well, I feel great, and they take themselves off their medication, and then they have an upsurgence of those depressive symptoms again, and it's because the medication was working. That's why you're feeling good.
Right.
And that's Allie Trutman saying that. That's not Dr. Nicholson saying that. So I think
that's great advice, though. Please don't stop your medications without consulting your physician first. Okay.
Yeah. That's awesome. Thank you.
Yeah. So I think that's it really for those medications.
Okay, that's wonderful. Yeah. And were there any other outside of classifications of medications, SSRIs, benzodiazepines, were there any other, like, as you're looking at integrative medicine, supplements or vitamins that people would be recommended if they're going through treating anxiety? I know you mentioned essential oils, but I just wondered if you go to the doctor and she says your immune system's down, you need to take X, Y, and Z, or it would be great to add this to your smoothie.
Oh, there's so many, but I don't know that I'm prepared for that conversation, because I would like to have a very thoughtful discussion for that, and maybe we could have another
round 2
chat someday about it, because I'm very passionate about the integrative medicine focus, which really is not taking away from conventional care. We still believe in using conventional medications, but also looking at other approaches, like I said, lifestyle, but also some supplements and natural herbs and things like that. So.
Oh, I love that. The treating the total person, right?
That's right.
The mind, body,
spirit,
and stomach. Everybody has to include that, because that's how you're absorbing everything.
That's true. And a side note on the stomach is the majority of our serotonin receptors are in our gut. So it's not uncommon for the anxious or depressed individual to have some sort of gastrointestinal symptom along with it.
Yes.
So that would explain it because of the serotonin receptors we do have in our belly.
Sure,
But again,
that
you want to be
makes-
working with your doc on that.
Yeah, again, work
Again.
with your physician. We are not diagnosing you on this screen right now. So. Well, again, thank you so much for your time, your expertise. I know that our followers on YouTube, when they see videos of us talking about mental health, about issues that are relatable, they find the most benefit in that. So
That's great. And you know, it's nothing to be ashamed of. I encourage everyone to reach out. If you need help, there is no shame in reaching out, and there are people that want to help you. So please do that if you're struggling in any way. Thank you so much for having me.
Absolutely. And I always tell people on all of our live videos and our videos, you can always email me. The phone number 855-55-WICKED goes straight to my cell phone. My email address is Allie, ALLI @wickedshoots.com. You can send me any questions. I am no physician, but I can certainly point you in the direction of some good information. So again, thank you so much. And don't forget to tune in to our Facebook Live page tomorrow as we talk about yoga and Tibetan monk practices that are going to help us calm our bodies down, as Dr. Nicholson was mentioning, calm our bodies down and prepare us for better, sounder sleep. So don't forget to tune in. Thank you guys so much for watching, and I hope you have a wicked good day.